The Dentalpreneur Podcast. Okay, doctor, it's time to put down that handpiece. You're listening to the show dedicated to helping dentists get their lives back. It's time to decrease your stress, increase your profitability, and regain your passion. Now introducing your host, Dr. Mark Costas.
Hello, everyone. Welcome to another episode of the Dentalpreneur Podcast. I'm your host, Dr. Mark Costas. How you doing, my friends? Here at the exhibition hall at Thrive Live 2026, Las Vegas, Nevada, day 2. We got 3 more podcasts left. I think 14 or 15 in the can. It's been an incredible weekend. A lot of fun here. A lot of good energy. I do think that most definitely the exhibition hall is a lot louder when they're serving free booze, and they're not doing it just this moment. So we have a nice little quiet reprieve from the loud chatter. I am super excited to say hello and catch up with an old friend. Her name is Michelle Strange. She's an MSDH and an RDH, and she's a practicing dental hygienist, educator, and entrepreneur with over 25 years of experience in the dental field. She began her career as a dental assistant, then a dental hygienist, earning a bachelor's degree in health science from Medical University of South Carolina, followed by a master's degree in dental hygiene education from the University of Bridgeport. Her commitment to excellence is demonstrated by ongoing professional development, including earning a certificate of dental infection prevention and control, myofunctional therapy, interim restorative therapies, and neuromodulators. My God, you are accomplished. How many more things do you have to have after your name?
What else can I do?
How many more initials?
What other options do I have?
You have the alphabet after your name. Congratulations. Hey,
Thank you.
How are you, man?
I'm doing great.
It's been several years, I think.
Yes.
I remember, was it Voices of Dentistry?
It
like
probably was,
8 years ago, last time I saw you, it was something crazy
it was
like that.
pre-pandemic or something.
Yeah. You used to have a podcast called A Tale of Two Hygienists.
Yeah.
It was really funny.
Yeah, thank you.
Yeah, you guys don't do that anymore.
I don't know.
Yeah.
No.
But you were on to bigger and better things.
Yeah, I got bigger things to do.
Okay, so since we saw each other last, we were just talking really quick in the pre-chat. You've had quite the exciting time and quite the exciting life.
Yeah, so I've been doing a lot since I think last time. My entire life is different.
Talk to me. Talk to me, man.
Yeah, I guess since the last time we talked, I was in South Carolina. That's where I lived. I was traveling all over, speaking and working for different companies. And then
you're a KOL for a bunch of companies, right?
Yeah, I am. I do a lot of infection control topics. I talk a lot about guided biofilm therapy, dental hygiene stuff, minimally invasive stuff. And then,
were you still, when you were doing that KOL stuff, were you still active clinically?
Yeah, so I've always been actively in the clinic, but maybe then was just like one day a week or something like that. Clinical care brings me the most joy. So,
really?
Yes. Yeah. That's
interesting. Okay.
If I am not doing something at some point in somebody's mouth, then I'm not.
No kidding.
I don't know. Isn't my gratification? Don't you get like that? Like when people actually get it and they're like, oh my God, that was the best appointment I've ever experienced. I'm like, this is what keeps me going.
Yeah. Yeah. I don't do it for pay anymore. I do it for free on mission trips.
Yeah.
And it does fill my cup.
Yes.
But there is something extremely satisfying about working with your hands, working with patients.
Yeah.
I just kind of burnt out after 22 years of grumpy patients. Some are nice, some aren't.
You're telling me. I'm 21 years now as a hygienist, so same.
You started when you're 3.
I was a fetus when I graduated.
I was a twinkle in my mom's eye.
Like a little zygote walking the stage.
That's awesome. Okay, so you had a period of time where you were traveling around, you were KOLing, doing a little bit of clinical work, and then you just hit the road, huh?
Well, I guess when we all got kind of stuck at home during the pandemic and everything, I kind of decided that I didn't like living where I lived anymore. And I literally sold everything I owned. I packed up what was left in a 12-foot trailer that I bought, and I towed it around the country. And
did you live in it?
No, it was more like my mobile storage unit. The whole right side is all dental products, all my mobile dental equipment, because I would go into nursing homes, and I got my license in each state that I went to. Well, some of them were too hard, and I was like, I'll be gone by the time I even get a license. Yeah. But I just got my license and would be like, well, where do I want to go next? I want to go ski in Colorado for ski season, so I'll go live there. And I did that for 3 years.
Wow. What was your favorite?
I mean, I think Colorado is definitely my favorite because I can do the most as a hygienist there. But I lived in New Orleans for a little bit. Love New Orleans. I lived in Montana for a little bit. But I think Colorado is the one that I stayed in the longest because I enjoyed it.
Do you like skiing?
I do. Yeah.
Awesome.
Yeah.
So that's an important part.
It's nice. Yeah.
Yeah.
It's
So now, just to circle back around with your trajectory, now you own a dental practice in Colorado. Tell me, how does that work?
So
how
Colorado
exciting.
has been able to do this since the 80s. This is their 40th year that you can operate independently. So I can do with everything within my scope of practice as a hygienist.
Okay.
I refer to dentists. Dentists refer to me. It's more like a specialty situation.
Okay.
I have 2 other hygienists that work under me. I'm the 3rd hygienist to own this practice. So it's been around since 1998.
Okay.
So it's a very easy stepping into it. Had great goodwill, and everything was kind of established, so it's lovely. And I'm hoping to grow and go back into mobile dentistry, because I working with the elderly in the nursing homes and stuff. That's actually what I really love to do.
With the mobile dentistry, would that just add production to your existing facility?
Exactly. So I'll keep I have 2 operatories, so I'll keep 2 operatories going, booked and busy. And then I would then free up myself, hopefully, to go into the mobile setting and then be more manager of the clinic and stuff. Yeah.
Cool.
Yeah.
How many days a week are you working now?
It really depends on how often I'm speaking. So this week I was 2 days a week. I was Tuesday, Wednesday, and then had all day Thursday doing meetings and working with sponsors and all that fun stuff, and then flew out here today.
Yeah. Wow. All right. So let's get into it. What's it like to be a practice owner? I mean, I know what it's like, but what's it been like for you?
I actually really enjoy it. I enjoy not having to ask permission to do anything that I want to do.
That's kind of nice, right?
I like that after 20 years.
Yeah.
Not saying that my dentist didn't let me do good things, but I always had to ask permission to get new scalers or try a new product or bring something into the office. And I don't have to do that anymore. And it's great. I love that part.
Yeah.
But I was joking with you at the beginning of this that, I spent 20 years of my career being a great clinician and
purposely ignoring the practice management stuff.
I literally was like, la, 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 la. I don't know. CDT codes, not my problem, not my job.
Yeah.
And now I'm playing a lot of catch up. So
Totally.
that part's a little difficult. And, but I just genuinely enjoy, I don't know, just doing it the way that I've always seen it done as a clinician and not having to be fall in line with anybody else's policies and practices.
Sure.
But, it took me 20 years to get there. So, and hopefully I live the last 20 years of my career as, doing it my way.
Doing what you want.
Yeah, exactly.
So, tell me about how, the logistics of it. Are you typically bouncing from room to room, or do you have another hygienist that's working side by side with you?
Yeah. So we currently, maybe one day I'll have an assistant that will help me do stuff, but really we work very independent. We kind of do all our own charts, our own sterilization, all of that. And then, I just see patients every hour on the hour. So I get to do all the cool stuff, all the AI. I can do interim restorative therapy. Come end of July, I think it gets written into our state practice act, but I can do Botox, I can do HPV vaccinations,
really?
I can prescribe antibiotics.
That's so cool. Only in Colorado?
Yeah. Maine has a similar practice act, and then there's a version of that in other states, but there does have to be some level of a dentist involved in that. But in Colorado, it's completely independent.
That is so cool.
Yeah. I can maybe even hire a dentist one day.
You should.
Yeah. It'd be nice to have it all under one space.
Can you restore?
I can do interim restorative therapy. So, scoop everything out, kind of carve it out, and then pack it with glass ionomer.
Got it.
I do need a collaborative dentist with that, just in case I cause any pulpitis or anything like that. I have a place to go. But it's a really great thing to do in the school-based programs. I see a lot of Medicaid patients that to find a dentist that takes Medicaid is sometimes hard in certain areas
Very
of Colorado.
Yeah.
So I can do all of that for people and get them out of pain, which is really great.
Cool.
Yeah.
That's really cool. Tell me about your philosophy of care.
It is
and you can
people.
wrap in the KOL stuff with that too. Because
I like the patient care stuff.
Well, obviously your philosophy of care has to do with the products that you endorse and all that stuff.
Absolutely.
So maybe we can kind of just talk about all of it.
Yeah, no, that's a good point, because I do very much, I go from a KOL standpoint, I stay in my lane. If I don't work with it and don't use it, then I really don't talk about it all that much.
I like that.
I really try to even in my implant courses, I just got a new laser, just got my laser certification and stuff.
Cool.
And so now wrap it into my courses on implant maintenance because but I haven't talked about it because I haven't used it. So I just felt like it's not, not my wheelhouse. So I'll stay on my own lane.
Just to put a little pin in this. So like you can give anesthetic, you can do
lasers,
SRPs, and you can do lasers, all of that. So that's really advanced in Colorado.
Minimally invasive. So all SDF, Curodont, all of that fun stuff. I can do all of that. And then I got the cameras that are seeing intraoral caries. I got AI. I have all of this stuff, anything that BlueCheck. I have literally anything that helps me catch things so early to be the true prevention specialist that I do believe hygienists can really step into.
That's cool. Yeah. That's cool. Okay, so back to philosophy of care, because I totally interrupted you with a random question.
That's all right.
Yeah, philosophy of care.
I have ADHD. I can keep up.
Yeah.
So my philosophy of care is really meeting people where they're at, like making sure that they never feel judged, never feel shamed. They always feel seen. Even if they don't want to always adopt my treatment plan, that I never dismiss them. I never be like, well, if you're not doing SRP, you can't be in my chair kind of thing. Like, we are going to figure this out together. We're going to go along this journey together. I really catching things super early is my philosophy. And then just making sure that like my team always feels seen and validated and just held up on a pedestal, because I think they're doing amazing work. If you're doing independent hygiene and willing to take on some of that liability, I want you to feel like very loved and seen.
Yeah. What are your favorite products now?
Oh, that's a good
question. Tell me about Curodont and like, well, SDF obviously is I use SDF a lot on my mission trips all the time. So tell me kind of what you love to talk about.
Well, first of all, I love guided biofilm therapy. I do that. It's a standard in the office. So I love that I can offer that. And it's such a easy thing for patients to be like, oh my God, that was the best thing that I've had in years in a hygiene appointment. So I do EMS, the airflow, GBT. I'm trying to think of all the things that I do in a day. Curodont, I do on those early lesions, but I use BlueCheck, which will show us really incipient,
for people that don't know what those two things are, sure. BlueCheck and Curodont, can you explain what it is and what's the clinical basis and how do you apply it and all that stuff?
So for BlueCheck would be one that's an easy one. So it shows pre-visible lesions. Okay. So it's a dye. Once you're done with your prophy, you paint this on. And if it is that early incipient lesion, it'll soak in that little bit of blue.
Okay.
So those half moon, you're it's a white spot. I don't know if it's active or it's not. If it's an active lesion, it will soak in that blue. And I can be oh, this is a perfect case. There's no guessing, right? Mm-hmm. I know that it's a problem. We have Curodont, we have SDF. It really depends on the area of the mouth. So anterior, I'm obviously going to go more Curodont situation. But SDF, I'm putting on interproximals all day, every day on a lot of these people.
That's nice.
It's real nice.
Let's see if we can avoid those class 2s, man.
I know, but I'm also doing it around crown margins all the time. I just got out of a 12-week cariology course with Dr. Ryan Nolan, and I am re-looking at all my products for dry mouth patients, for those early incipient lesions. How can I truly be a prevention specialist? So those BlueCheck, Curodont, SDF, all of my fluorides, I'm definitely using those a ton. How
do you apply Curodont?
So Curodont is going to be, you etch the surface, you kind of paint this on there. It used to be it had to be dry for 5 minutes, so patient selection was really important. So your little kiddos or any of my patients with healthcare disabilities, then I really had to be selective on that. But I think now it's less than a minute, it can stay dry, and we're seeing great results with it. So that's pretty cool. And it will almost heal from the inside out. That P11 peptide will get to that base of that lesion and really start to create that scaffolding to repair that lesion. So it's very cool stuff. Yeah.
That is cool.
Yeah.
What are you speaking about mostly, and what are you speaking about this weekend?
This weekend is implant maintenance. I've been talking implant maintenance for a decade now. I thought I'd retire that course, but apparently it is still very popular.
Very important topic.
Still very popular. And then infection control is my next biggest course. I talk a lot about that. I have a company called Level Up Infection Prevention, where I teach people how to do SOPs for all their infection control stuff and train their ICC, their infection control coordinator.
Cool.
And then I do a lot on minimally invasive, so looking at all those fun, cool products, guided biofilm therapy. And then I lecture a lot on patient engagement, motivational interviewing, how to help patients move out of that ambivalence and towards treatment and saying yes and actually caring about the things that they do at home.
Can we talk a little bit about that?
Yeah, that'd be so cool.
They're very interesting to me. So how do we work through ambivalence and the fact that it just doesn't hurt? So you're trying to, I just want a cleaning.
I just want a cleaning.
That's it.
You know, so motivational interviewing is a technique that I use. It started in substance use counseling, and it is a way to get people to move out of that ambivalence by making them know and understand they have autonomy. Asking tons of open-ended questions.
Yeah.
So one of the philosophies is OARS, open-ended questions, affirmations, reflective listening, and summary. Okay. So open-ended questions is kind of like the easy one. So instead of saying, are you flossing your teeth? I say, tell me, what tools do you like to use at home to clean between your teeth? Mm-hmm. Like, that's a much different question.
Yeah. You can't say yes or no.
Yeah. And then they'll look at me like, what do you mean I just floss? And I'm like, well, floss is not the only thing that we have these days. Do you like flossing? Is it a problem for you? Do you see bleeding when you floss? Like, do you struggle with flossing? And they're like, yeah, I hate it. I never do it. Like, it always shreds it. I'm like, have you ever tried a water flosser? Have you tried interdental brushes? Have you tried any of these other little tools that we have in the world now? And they're like, oh my God, I didn't know those were a thing. I also asked, like, on a scale of 1 to 10, tell me how healthy your mouth is today. Mm-hmm. If it's a 6, why is it a 6? What would make it a 10? You know, and sometimes it's like, oh, my teeth have been getting wet, or, you know, more yellow, more dull, or like, oh, I keep having this sensitivity. Oh, well, when I just asked you, is there anything bothering your mouth? You said no. You know, obviously, I don't want to say that to them, but I say, oh, you're having sensitive. Tell me more. Mm-hmm. Tell me what's going on. How long has that been going on? Is it anywhere else? Is it consistent? I'm doing sleep apnea screenings and stuff. Like,
oh, really?
Because hygienists are also in charge. Like, I can look at their back of their throat. I can look at their uvula. I can look at their scallop tongue. I can look at their tongue posture. I also have myofunctional therapy. I'm certified in myo. And so I'm doing all of those things and having these bigger conversations. Tell me how you're sleeping. Do you struggle with sleep? Do you feel like you're crunching? The list goes on. But I'm engaging them in a way where I'm asking those open-ended questions so I can truly get to a place where, like, you have options. And I'm just here to give them to you. Tell me what works for you. What have you tried? What did you not like? Where do you see bleeding? You know, a patient that's like, oh, I have a water flosser. I never use it because it does like X, Y, and Z. I'm like, have you used it in the shower before? In the shower? I'm like, yeah, like clean your teeth, clean your grout. It's great. Like, you know, like hang out in the shower a little longer, deep condition your hair. Women love it for that. Like, you know, that kind of stuff. And I keep giving them solutions, but me talking at a patient has never gotten me very far.
Yeah.
You know, me centering myself and all the cool stuff that I know after I learned at these conferences has never gotten me very far. It actually has just made me very disheartened as a provider, because when they come back and they're like, Dr. Oz told me, and I'm like,
Dr. Oz.
Oh my God. So I just engage them a little differently. And I just always remind them that they have the option to tell me no. So I'll say, if I have any suggestions today, are you open to hearing those? And they'll be like, isn't that why I'm here? And I'm like, well, yes, I hope you are open to my suggestions, but you can tell me no. And you know what? I won't like hound you. I've had 2 people in my career tell me no. And I've sat them up. And they both go, well, what, did you see anything? I'm like, I did. I am a little concerned about something. Is it okay if I share that with you? And they give me that.
That's funny.
They give me their permission. Like, I want them to know that they have autonomy to, like, because, you know, I don't know what just happened. They could have come off a Zoom call of, like, their boss yelling at them, and then they're sitting in my chair. They don't need to hear me lecturing at them, too.
Exactly.
Let them calm down. Let their cortisol, like, calm down, settle in. And also, like, I'm a trauma-informed care provider. So I've gotten extra, education around trauma and people's potential to sexual assault, sexual abuse, childhood issues. We are working in a very intimate place and in a position of authority. And so I want to make sure that they know, like, they always have the ability to tell me no in my office. Yeah.
That's awesome. So, what's next?
Oh gosh, that's a good question.
Yeah.
I feel like even though I'm very much a Virgo rising and planner, I really don't always know my next move. I just kind of go what lights me up, what brings me joy, and if it's not bringing me joy anymore, then I just move on from it.
Yeah, that's cool.
Keep doing that.
It's funny, you went from a very, very mobile lifestyle to owning a business, which plants you pretty permanently in a space, at least during the time that you own it.
Yeah. And, I do have a great team that is supporting me, so I can come and still do this where I'm at conferences and I can go on trips and do stuff like that. So I don't feel as stuck, but I did have to grieve my wanderlust a little bit.
I bet.
I'm very much a let me just go see the world kind of person. And so, yeah, it is not lost on me that I'm stuck a little bit.
Do you have any current travel goals or places that you really want to see? Any sort of priority or hierarchy for that?
I want to go to South Korea for all the beauty stuff. I love skincare is my hobby, so I like doing that.
It's so many people are traveling to South Korea now for
all the things.
Skincare.
Yes, I would love to do that.
Yeah, they have the best skincare in the world. They have the best
really
skin
do.
in the world.
They do, because they
ridiculous.
Really elevate their services.
Yeah.
And I haven't been to Bali and all those. I've gone to Europe a ton of times, but go wherever the good deal is, I guess.
Yeah, for sure. Are you currently taking speaking gigs?
Oh yeah, I'm here speaking tomorrow. So yeah, I'm out and about speaking, pretty booked actually.
Awesome.
But would love more if you want to.
Yeah, that's what I was going to say. That was my segue into, Michelle, can you share your contact information for anybody that would want you to speak at their conference or event or wherever it is that you speak? And then any other thing that you want to promote or contact information
talk
you want
about,
to give. Yeah.
So my website is michellestrangeRDH.com. That's where you can find a lot of my speaker's packet, all of that information.
There's an E at the end of your name.
Yes, it's like you can be strange.
Yeah.
Strange like the word, folks. It's not that fancy. And then if you are interested in infection control stuff, that's really kind of the thing that gets me excited is the protocols and systems that make sure patients are safe always in every appointment. And that's Level Up Infection Prevention.
Awesome.
Yeah.
Awesome. Hey, it was great catching up with you, Michelle.
Thanks for having me
After
on.
however many years, I don't know however many years it was. You look fantastic.
Thank
you look
you.
the same. Congratulations on having your practice and all of the adventures that you've had.
Thank you. I appreciate coming
on. It's inspirational.
Thank you.
All right, ladies and gentlemen, Michelle Strange.